Blood thinners can save lives, but they don't actually thin your blood. So how do they prevent dangerous clots? Let's break it down. Your blood naturally forms clots to stop bleeding when you get a cut, but sometimes clots form inside blood vessels, where they can block blood flow and cause serious issues like heart attacks, strokes, or pulmonary embolisms. Blood thinners help prevent these clots from forming, or stop them from getting bigger. There are two main types: anticoagulants, like Warfarin, heparin, or newer drugs like apixaban. These slow down clotting by blocking specific proteins in the clotting cascade. Antiplatelets, like aspirin or clopidogrel. These stop platelets, tiny blood cells, from clumping together to form clots in the first place. Both types reduce the chance of clots forming in arteries or veins, but they don't dissolve clots that already exist. Because they affect clotting, blood thinners can increase your risk of bleeding, even from minor injuries. That's why dosing needs to be carefully monitored. If you found this helpful, hit subscribe for more medical animations.